Lovely, thank you very much, and good morning, everybody. I'm Dominic. I'm the Director of Policy and Public Affairs at Carers Trust. Also really pleased to be with you here today and to see so many different professions and sets of expertise around the tables. Colleagues joining me at table 11 have already commented on how well organised this session feels, and going around the room, lots of great exhibitors too that we work very closely with at Carers Trust. So do go out and reach out to colleagues and have a chat and say hello to them, because lots of really interesting work that's happening across the place. I work very closely with Emily and with other organisations in trying to get carers that little bit further up the agenda when it comes to decision makers, thinking about funding flows, thinking about all the different bits that we know make such an important part of the system. I was a young carer myself for my mum when she was living and then dying with breast cancer. I've since been a carer for my grandfather too, so much like I think probably many, if not most, of the room here today, I've sort of seen it from that side, and that's a lot of what drove me into this role and into this line of work. And for those that aren't so familiar with Carers Trust, we are a network organisation, so we work with 135 local services right across the UK, and Carers Bucks is one of the crown jewels, supporting and reaching around 1.1 million carers a year, providing all sorts of different services, both sort of digital and working with partners in the room, right through to arrange in-house and then working with the NHS and various other bits too. My talk will consider some of that national picture, thinking of three different aspects. Carers as being more than a label, carers as more than a safety net for the NHS, as they're so often considered, and the importance of building on the offer currently put to carers. I think that relates to a lot of what we'll talk today about in terms of the new strategy that's in place in Bucks. So we talk a lot about identifying carers, but what if the problem isn't who we're missing, but how we're looking? As Emily mentioned, it's not how people often introduce themselves. It's not what most people feel defines them. And yet, crucially, without the label of carers, they're often left out. No access, no visibility, no support, no label, no help. But once you do accept that label, you often find your identity somewhat flattened by it. People care while being many things at once: a partner, a parent, a professional. The moment we ask them to tick a box, we risk boxing them in. And on here is from one of our projects where we were working with carers to sort of say, well, what does caring mean to you? What are the different roles that you take part in? How do you define yourself? And you can see from that wheel that the list is pretty endless, and actually we ran out of space to put more things on, so we had to draw the line there. And that matters, especially now, because we're heading into a time of deep policy shifts. The NHS 10-year plan, the Casey Commission on Social Care Reform, the reshaping and ultimately closure of central NHS England. And beyond health, as we've heard this week, plans in the pipeline from government on welfare reform, immigration, assisted dying, employment, and local government reorganisation. All of them, directly or indirectly, touch on the role of unpaid care. And in all of that, we have a choice. We can carry on with a system that gatekeeps by label, or we can build something better, something that recognises care without demanding people reorder their identity to access it. When we define care too narrowly, policy misses the full picture and practice misses the person. And let's be clear, particularly as we approach Carers' Rights Day on Thursday, carers are not the same. Race, gender, class, age, disability, language, culture, all shape how care is experienced, expressed, and understood. And it means recognising this truth. Caring is not rare, it's not niche, it's not other. It's something most of us will do or receive at some point in our lives. It's not a badge some people wear, it's part of being human. And when we start from that truth, that care is not the exception but the norm, we open the door to more inclusive and human systems that are more responsive to the sheer demands that fall on many people, which we should never accept as normal. Carers need more than the current offer in place across the country. In many cases, it's not just inadequate, it's actively contributing to mental ill health, physical deterioration, poverty, and breakdown. And while everyone in this room is among those fighting hardest to improve things, we have to face a hard truth. As a society and as a system, we are often failing those in the most challenging caring situations. And that failure isn't falling equally. It's falling hardest on women, on people from poorer backgrounds, and on minoritized ethnic communities, who are more likely to take on caring roles, less likely to be recognized, and less likely to get support. Meanwhile, the demands on carers are only growing. Directors of adult social services across England, over 90% of them, report increasing levels of need among carers in their area. And it shows up across nearly every data point. In the GP patient survey, 70% of carers reported a long-term health condition themselves. Recent challenging research in Birmingham has raised the alarm on rising rates of suicide, homicide, and self-harm among carers in crisis. And yet, last year, 70% of carers assessed by the state across England received no direct support at all. Just information, just signposting, or nothing. So we're expecting carers to hold up the system, whilst as a whole giving too little back in return. Population, cost of care, complexity of care, need, all up. But support, often static or shrinking, both in volume and variety, as budgets have been eroded. Carers don't want medals. They want to be seen, trusted, resourced, and rested. Value is not having to fight for respite. It's a GP who knows your name and your role, knowing that there is local support in your area, and not having to quit your job to stop a hospital readmission. And that's why local services matter, not just in theory, but in the most practical human ways. Lots desperately need that tailored, hands-on intervention. It's support to get to the clinic. It's a break that doesn't take months to arrange or involve putting the person they care for in an assisted living unit. And it's a phone call when you're drowning, not when you've already sunk. And let's be honest, carers aren't waiting to be empowered. They're already doing the hard work. They're patching gaps, streamlining chaos, building networks, and improvising in ways that many of our best policy designers would struggle to replicate. Every day, unpaid carers are delivering the very things we ask of our health and care leaders in this country. Integration across silos, resourcefulness in constraint, and real-world decision-making under pressure. Where the system sees bureaucratic bottlenecks, carers have little choice but to see workarounds. Where professionals pilot joined-up thinking, carers do joined-up living across health, school, housing, work, and emotional care. As I often say, innovation is happening at the kitchen table. Carers' ideas, feedback, fixes are often shared in passing in peer support groups, in moments of stress, in quiet conversations with a GP or link worker. Much of the system just hasn't caught up, nor does it often listen, could be gathering better and designing forward with carers in a lead role. By contrast, local carer services, like those at Carers Bucks, are often co-designed with carers. And it's hugely encouraging that carer voice clearly runs through both the Bucks 2025 to 30 all-age strategy and the process that went behind it. Likewise, that Baroness Casey has made clear that she wants, above all else, to hear not from dusty folk behind a desk like me, but from those with the lived experience to inform her commission on social care reform. Real-world narrators of what it's like to provide care, solve problems, and hold lives together in the very neighbourhoods policy intends to transform. But we've built much of our existing national health and care policy without enough of that input, when it could be so key to big-ticket items that our politicians focus on. NHS waiting lists, about 26% of people on them are unpaid carers. Hospital discharge or virtual wards, research shows that both work best with carers at the core. Integrated neighbourhood teams and self-managing health is at the heart of the NHS 10-year plan. All carers and neighbourhood working go hand in hand. Self-management is rarely just about the self. It is often collective, often shared, and unpaid carers are often the ones who make it possible. Without them, self-management becomes a burden dressed up as empowerment. With them, and with the right scaffolding of support, recognition, and access, it becomes real, it becomes sustainable. Now, I would need a good 2-3 hours on this stage, which I will save you from, to be able to go through the different groups of carers for whom there's been significant progress over recent decades, and a lot of that sits with people in this room today. But as Emily mentioned, we do a lot of work at Carers Trust around young carers, a group who not so long ago perhaps had minimal recognition or minimal identification as even existing. Since then, we've seen changes to the law. We've seen changes in terms of how they are integrated into planning and action. And I saw that a young adult carer had written the foreword for the carer strategy here, which is fantastic, and that there is a offer for young carers, both digitally and through Carers Bucks. We've also seen progress in terms of how many people want to commit to change things for young carers and recognizing that actually people shouldn't be carrying such a burden. So on the right-hand side of the screen there, you can see the Young Carers Covenant that many areas, the Scottish Government, the Welsh Government, Department of Health and Social Care, Department for Work and Pensions, Department for Education, have all signed up to. And those are points on there that those 10 principles have all been chosen by young carers as the things that are important to them. And it's so important that we do. The image on the left, which is my own image from the FA Cup final where Arsenal beat Chelsea. The capacity of Wembley Stadium is 90,000. Now, you could fill that entire stadium and still require 2,000 more seats for the number of young carers and young adult carers that provide 20 hours or more care per week. You could fill Centre Court at Wimbledon with a number of young carers who provide 50 hours or more support per week. So there's a lot of people out there. Lots of schools do not know that they exist. Other parts of the system do not know they exist. But it's absolutely the right thing to fight for them. So if we want to get serious about reform and being ready for the future, we need to start with carers' experience. Ask what makes a difference on Tuesday morning when the care package falls through, or when they haven't slept at all that night. That's where you find the real levers of support. And that means building community-based support that doesn't wait for crisis. Peer groups, navigators, local hubs, a digital offer, out-of-hours support. Recognizing that practical support is emotional support. A carer who isn't carrying everything alone is not only more stable, they're more confident, more resilient. Funding grassroots, trusted, relationship-based organisations, the ones who know carers by name, not a reference number. Services in our own Carers Trust network receive, on average, just £91 per registered carer per year from the state. And yet they deliver emotional support, practical help, community connection, and crisis intervention. Sometimes pigeonholed as voluntary sector, sometimes social care. They are, in truth, mini anchor institutions. Over decades of learning to get to where they are, decades more learning from each other on what works best. But the sustainability of many are at risk, experiencing a 20% real terms cut since 2022 across the country. At the same time, costs have skyrocketed. And let's stop relying on the ostrich effect, the habit of pretending caring will never touch us. Let's retire the hero narratives, which feel good, but often excuse those in power from doing more. Carers need a better offer from the deal or no deal banker. And that starts by showing them they matter, not just in principle, but in practice. But dozens of you have come here today because caring is important to you. People in their thousands volunteer to support carers across the country, and days like Carers' Rights Day help demonstrate the strength of feeling to making positive change. Our Prime Minister, down to our neighbour, has experience of care, and I think we can use that with the energy, heart and determination of those in this room, helping to lead the way. Thank you.